You're listening to SDO Isabela Radio-Based Instruction.
Come on, Mape!
Yay!
Mape paawit, Mape pagguhit, Mape sayaw at Mape lusog ka. When learning continues in Mape Edukalidad. Hey!
When learning continues in Mape Edukalidad.
Hello everyone! It's a really great day because it's a fine day today. Welcome to your safety adventure. You're listening to Radyo Eskwela sa Isabela. I hope everyone is doing great and excited to learn. Let us make today a day to learn something new. This is your radio teacher, Rhea Jane Valia Bernardo saying, health is wealth. Now, take a deep breath and relax, and let's get going. Are you ready? You are so awesome. Before we start, make sure that you are now holding your paper, pen, and notebook. I will give you a few seconds to prepare your materials after 3 counts. I will start counting now. 1, 2, 3. Looks like some are still preparing. I will count again. 1, 2, 3. Very good. Now I guess everybody is ready. Okay, students, what do you think is the lesson all about? Yes, it's all about health. Surely, this will be a very exciting safety adventure because you will learn the proper procedures in assessing emergency situations and do primary and secondary survey to victims. Before we start our lesson today, let's have a diagnostic test that will surely help boost your interest and serves as a warm-up before we start. Everything is set, so let's get started. I will read to you the statements and tell whether each statement is true or false. Write your answers in your activity notebook. I will just read each statement once, so listen carefully. Number 1. First aid is an immediate and temporary care given to a person when suddenly gets ill or injured. True or false? Number 2. The main objective of first aid is to save lives. True or false? Number 3. First aid ends when the service of the physician begins. True or false? Number 4. First aid prolongs life. True or false? Number 5. First aid builds the gap between the victim and the physician. True or false? Now let us check your answers. For number 1 to 4, the answer is true, while number 5 is false. Now, check your answers. How many correct answers did you get? Good job! I'm sure you have your idea what will be our topic for today. Did you get a perfect score? Wow! You're brilliant! Job well done! My dear students, are you ready? Great! Let us now explore a safety adventure. Have you experienced being in an emergency situation? What should you do in such situation? Correct! You should assess what is happening around you. But how? Alright, let us find out. Do you know some standard procedures on how to assess an emergency situation? To answer the question, let's answer some questions I prepared. What are the 5 characteristics of a good first aider? Anyone? Yes, it's gentle. Very good. What is the second? Observant. Correct. Third is resourceful. Bravo. What is the fourth characteristic? Tactful. Absolutely correct. And what is the last characteristic? Sympathetic. That's right. Having these characteristics will surely make our victims safe, though they are in pain. Now, what is the first thing to do when assessing an emergency situation? Yes, first, determine if anyone is in danger. If the danger cannot be managed, call for emergency help and protect the scene. Second, move to the quietest victim. Gently shake the victim's shoulder and ask if he or she is okay. If there's no response, check the airway. Third, open the airway. Do the head till chin lift method. Lift the chin and remove any obstructions present and gently tilt back the head. Fourth, check for breathing. If breathing, check and treat any life-threatening conditions and place in recovery position. If not breathing, pinch the nose and do mouth-to-mouth resuscitation. If the rescuer is alone, call for an ambulance. And the last is, look for signs of circulation. If the victim is a child or an adult who suffered from drowning or an accident, proceed directly to CPR and observe when there is movement or normal skin color. Now, you have learned how to assess emergency situations. Can you name them again? Good! Are you ready? Cool! Let's begin!
Tayo na sa Radyo Eskwela. Tayo na!
What is the first step? Yes, determine if anyone is in danger. Awesome! What about the second step? Move to the quietest victim. Very good. What is the third step? Open the airway. Nice. Keep it up. And for the fourth step is check for breathing. Correct. How about the last step, that is between life and death? Yes, look for signs of circulation. Alright, good job. It seems that you understood the lesson. This time, let us discuss how to conduct primary and secondary survey of the victims. What is the difference between primary and secondary survey? Primary survey of the victim is used when the victim is unconscious and to find out and immediately life-threatening conditions. Secondary survey is used when the victim is conscious or has survived. It aims to detect everything about the patient's condition. Now, how do you undergo primary and secondary survey to a victim? Let's dig deeper on how to conduct proper procedures in undergoing primary and secondary survey to victims. What would you do if someone is hurt and nobody is there except you to help the victim? Yes, there are 5 steps to perform in conducting proper procedures in primary survey. First, check for the victim's consciousness. Ask the victim if he or she is okay by carefully shaking the victim's shoulder. If there is no response, not even mumbles or groans, the victim is unconscious and needs an immediate medical check-up. Second, open the airway. Find out if there is loss of muscular control in the throat area, which allows the tongue to slip back and block the throat. Lift the chin and tilt the head of the victim. The victim is an adult. This way, you will be able to lift the tongue from the back of the throat, leaving the airway clear. Third, check for breathing. Put your face near the victim's mouth and look, listen, and feel for breathing. Observe chest movement or feel breath on your face. Lastly, check for circulation. Locate pulse using your middle and index finger. Poor blood circulation may be reflected on the pale skin. This is fatal, so revive circulation and perform CPR immediately. Did you get it? We're done discussing the proper procedures in conducting primary survey to victims. Now, how do we conduct secondary survey? Yes, this is done when the victim is conscious or has survived. So, to detect everything about the patient's condition, first, history taking. This step is performed easily by doing the sample pain mnemonics. Read the meaning of these mnemonics in your module. Second, check for vital signs. In checking the vital signs, you need to check the pulse rate. Remember to use your fingertip getting the pulse rate. The pulse rate will be taken in different points in the body as indicated in your module. But always remember the no in getting the pulse rate. Never use your thumb because it has its own pulse. Can you follow? That's good. Next is checking the body temperature. Follow strictly the guidelines in checking the body temperature. Another one is respiration. Perform properly the guidelines in checking body respiration. Finally, check the skin color. Of course, follow also the guidelines in checking skin color. Are you still there? Very good. Now, the third is head-to-toe examination survey. You must examine the head and the neck. Are there any lacerations or contusions in the area? Is there a presence of blood in the victim's hair? If yes, immediately find out where it is coming out. Is there any fluid in the victim's nose and ears? If so, the victim has a skull fracture. Next, eyes. Pay close attention to the pupils. Consider the chart in your module when examining the eyes. Another is chest. Check for the cuts, penetrations, and other impairments. If the victim feels pain while you apply pressure onto his or her chest, there could be a rib fracture. The next part to examine is the victim's abdomen. Does the victim's abdomen hurt? Where is the pain coming from? Is his or her abdomen tender? Did you feel any lumps? Lastly, examine the back. Is there movement in the victim's lower extremities? Is there sensation in these parts? If the answer is yes, do not move the victim. Immobilize him or her. Alright, we're done discussing the proper procedures in conducting both the primary and the secondary survey to the victims. Do you have any questions? That's good. This time, let us check what you've learned. Let us recall the ideas you've learned by answering a closed test to come up with the correct meaning of aforementioned terms. Are you ready? Okay, let's start. Try to answer this in a sheet of paper or in your notebook. Secondary survey is used when the blank is blank or has revived. What words will complete the sentence? Correct. It is the victim and conscious. While primary survey of the victim is used when the victim is blank and to find out and immediately blank, life-threatening, blank. What do you think are the missing words to complete the statement? That's great! The words are unconscious, treat, and conditions. Seems that we can distinguish the two terms based on their definitions. Congratulations! Now, let's have a recapitulation of the lessons that we had just tackled. What are the steps in assessing emergency situations? Can you enumerate these steps? Very good. First, is the scene safe? If yes, proceed to the steps. If no, do not attempt to go to the accident. Call emergency medical services instead. Second, make sure the victim is lying on his back. If not, roll him. Great! The third one is, check for responsiveness by gently tapping the shoulder of the victim, saying, "Hey, are you okay?" Finally, if there is no response, call for help immediately. Brilliant! Alright, how do we conduct the primary survey of the victim? First, perform the ABC: airway, breathing, and circulation. Airway check if there is blockage in the airway. If yes, take it out using your pinky in a scooping motion. Breathing is use the maximum head tilt chin left method. And look, listen, feel. If negative, perform rescue breathing. Circulation. Use carotid pulse. If negative, apply breathing step. Pinch the nose and give 2 initial full breaths to the victim. Perfect! Next, take out the clothes of the victim that can block the compression area. Yes, correct! Finally, perform CPR to the victim. If the victim is revived, you may now do the secondary survey. Very good! How about the secondary survey? Do you need to record all the data and surrender to the rescue team? Yes, very good. So, how do you conduct secondary survey? First, interview about the acronym SAMPLE. S, sample. A, allergy. M, medication. P, past medical history. L, last oral intake. And E, events prior to the accident. Bravo! Brilliant! So, what is the next step? Carefully check the vital signs. Eyes, if it is dilated or shock, constricted, stroke or drug abuse. Pupils are unequal stroke or head injuries. Let's check the nose. Watery fracture or skull injury. Let's check the skin. If it is bluish skin color, that's lacking of oxygen. Let's check the body temperature and blood pressure. Yes. And the last step is head-to-toe examination. Check the following: deformity, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. There you have it! Do you have any question or clarification? Good! Now, we're going to have your short quiz. Are you very much ready to take our short quiz? Alright, listen carefully as I read the statements. I will read each statement twice, then write what is being asked. Again, I will just read each statement twice. Ready? Let's start.
Tayo na sa Radyo Eskwela. Tayo na!
Let's start. Number 1. What are the 3 essential data to be recorded in conducting primary survey? I'll repeat. What are the 3 essential data to be recorded in conducting secondary survey? Number 2. What are the vital signs that needs to be checked in conducting secondary survey? I'll repeat. What are the vital signs that needs to be checked in conducting secondary survey? I will give you a minute to answer the questions while I play the Radyo Eskwela song.
Pagkat kayo'y kinabukasan, ang pag-asa ng ating bayan, isa pusong pagkatuto ng matupad ang pangarap mo. Pagkat sa gitna ng pandemya, tayo pa rin ay magkaisa upang masigurong bawat bata ay bumabasa. Halina't matuto gamit ang ating radyo, pakinggan at unawain, aralin na ituturo. Patuloy ang edukasyon para sa ating henerasyon. Sa daan ng pagkatuto ay walang maiiwan. Kaya halina sa Radyo Eskwela.
Are you still okay? Are you still there? Did you enjoy the quiz, my dear students? Now, class, are you ready to reveal the answers? Okay, for number 1, the answer is conducting the ABC. Airway, breathing, and circulation. For number 2, the answer is eyes, which is dilated or shock, constricted stroke or drug abused, pupils or unequal stroke or head injuries. Nose, which is watery fracture or having a skull injury. Bluish skin color is lacking oxygen. Checking of body temperature and blood pressure, and that's all for today. Congratulations! For now, to commend you for a job well done, give yourself a round of applause. Your final scores will be sent to you by your teacher. This ends our episode today. Now, you may just put your answer sheets inside your envelope, which would be sent to the school for checking. If you have questions or clarifications regarding our episode today, you may just call or text your teacher in Helpline in your respective schools. That concludes our topic for today. Did you learn something new today? That's great! Always remember, make a habit to pray and read your mojos. Stay tuned in our next episode. On behalf of the scriptwriter, Ma'am Margaret C. Wee, and the RBI production team, once again, I am Rhea Jane Valle Bernardo, always reminding you we learn as one. Walang batang naiiwan sa SDO Isabela. Good day, everyone. God bless us all.
Patuloy ang edukasyon para sa ating henerasyon.
Sa daan ng pagkatuto ay walang may iwan.
Kaya halina sa Radyo Eskwela!